wear a mask, a face mask? Yes. I'm Dr. Bradshaw, and I'm going to tell you the facts behind why if everyone wore a mask, that's everyone, it would make a big difference, and the science to support that. First of all, the government has not been 100% truthful with us on this matter, because if everyone needed to wear a face mask or would wear a face mask, there wouldn't be enough for our healthcare providers. And really, the healthcare providers take precedent right now, so we need to make sure they have enough masks. But if the government would procure, develop, and distribute masks for everyone, it would greatly help. And if you look at, say, South Korea, if you look at the graphs, you'll see that South Korea really did a great job. They did a lot more testing and everybody was wearing masks. And the curve was flattened and they've gotten a lot better containment than most of the other nations where they weren't doing this. So why is it important, if we could, that everyone would wear a mask? Well, the real key is for those people who have got the disease, they've been infected, but you've got several days where you're asymptomatic, but you're contagious. So if you think about those people during those days, they're infected, but they're not symptomatic, they're out among us, they're going to the grocery store, shopping, etc., and they're sneezing and they're coughing and they're infecting people. But if everybody wore a mask, those people who don't know they're infected, because we don't have enough tests, those people would have the mask on, and so when they sneeze, they would sneeze into the mask. If you look at this picture of what a sneeze looks like, look at these. Well, actually, when you sneeze, there are 40,000, on average, 40,000 droplets. I mean, that's a lot of droplets, as you can see in this picture. It's horrible. Expelled at speeds over 200 miles per hour. In a cough, it's about 3,000 droplets. So if people that are infectious, if they were sneezing and coughing into those masks, if everybody was wearing them, 99% plus of those droplets would be contained. That's why it's so important. Now, people say that, and it's true, that a mask, a lot of the masks, like the simple surgical masks that people could wear, won't stop a virus from getting through. Well, that's true actually of the N95s as well. And let me give you an example just to see how this makes more sense. I did this kind of to scale. If this little tiny little dot you can't even see here, that's about the size of a viron. They're about 120 nanometers. You can look up how big or small that is if you'd like. But if you look at then the average pore on a surgical mask, or surgical type, like the little looped ones that go over your mask, over your face, if you take this line here, then multiply it 40 times. That's how big the hole is. That's how big the pores are, the openings in those masks, compared to the size of the viron. That's like asking, could a little BB make it through your open garage door? Well, yeah, no doubt it could, right? Now, one advantage to the mask is they're multi-layered, so it's not like you just have these holes lined up, if you would, like a doorway leading straight through a hallway. They're staggered, so you may have a piece of cloth like this, but then the other one, instead of lined up exactly on it, it's shifted a little bit. So the viron could potentially be caught, but these holes are so big compared to a small viron, obviously it wouldn't stop it. But how they stop it often is the viron, we're not shedding one viron at a time out of our mouth or our sneeze. These virons or virus particles are contained in the droplets that come out. These droplets vary in size. A lot of them are less than 100 microns. Well, the significance of that is if they're smaller, the smaller droplets tend to not go as far. It's the larger droplets that when you sneeze, they have enough mass because they're bigger. When they sneeze, they can go up to 6 meters. So that 6-foot spacing you hear about, that helps with a cough. The average cough, the average size droplet, is about up to around 6 feet. A lot of them are going to not make it 6 feet. But in a sneeze, they're going to go 6 meters, give or take. Larger ones even a little bit further than that. So again, if everybody were wearing these masks, most of the masks would catch these droplets that contain the viruses. So I showed you earlier this picture of the size of the virus. It's so tiny, tiny, tiny compared to the opening, the hole, the pores in the mask. But now let's look at an example, a representation of a droplet. The droplets come in varying sizes also. A lot of the droplets are represented by something about this size. Well, the N95 mask, its holes, its pores are so small, these average size droplets that go a distance aren't going to make it through the N95. They're not even going to make it through the first pore, let alone be caught on the next layer in the mask. The surgical masks, they say that don't really help at all. You know, maybe it catches it, maybe it doesn't. It's about the same size. But some of them are smaller. Some of the droplets are much smaller. These smaller ones may get through the first pore, but because there's multiple layers in most of these masks, they're going to get caught on one of those layers of the fibers. But again, that's because most of the virons are in the droplets. And again, if you think about it, if everybody was wearing a mask, it would greatly reduce the spread. So one question that comes up is how many viruses or virons are there per droplet? So if you think of the tiny, tiny little virus, how many of them, and they're so small, how many of these are there in a droplet? Then moving to a different scale, and I had this one showing droplets as an example. So the average droplet contains about 6,000 to 7,000 virons or viruses, virons individual, in each droplet. So that's a lot, 6,000 to 7,000 in an average one. Well, if this one, we'll say, has 7,000 in it, something like this may only have, 800, and something like this may have 200. So, but it's a lot. So again, the mask, if everyone is wearing the mask, you get those people who are infected but don't know it yet. They're out coughing, sneezing, and then they're going to start having symptoms and stay home. But in this period here, when they're going around infecting everybody, if instead they're sneezing and coughing into that mask, it's greatly going to reduce the amount of virons and viruses floating in the air and decrease infection. Again, look at the South Korea model. The ship has already sailed on doing the extensive testing for containment, but we can get everybody masked, and it would make a big difference if we would just have some leadership from both sides at the federal level. I'm Dr. Brad Bradshaw. Watch more of our videos on this and other topics and learn more about what you can do to protect yourself, your family, and help others. Thank you very much.